Hello and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Gail Garbarino. Effective January 1st, 2019, new and revised pain assessment and management standards will be applicable to Joint Commission accredited ambulatory care organizations, critical access hospitals, and office-based surgery practices. This project is a continuation of the initiative that resulted in new and revised pain assessment and management requirements for hospitals, effective in January 2018. In early 2016, the Joint Commission began conducting an extensive literature review on contemporary clinical guidelines and best practices for pain assessment and management, including safe opioid prescribing, in order to identify disparities between its current accreditation requirements and contemporary guidance. Following the literature review, a technical advisory panel of experts was convened to discuss developments in the field of pain assessment and management. The next step was to conduct learning visits to research leading practices in pain assessment and management and the safe use of opioids. The Joint Commission then convened a standards review panel to review draft pain assessment and management standards. Finally, the draft hospital pain assessment and management standards were released for public comment in January 2017. Similar to hospitals, the pain assessment and management requirements for ambulatory care organizations, critical access hospitals, and office-based surgery practices are now included in the leadership chapter at Standard LD 040313. The Provision of Care, Treatment, and Services chapter at Standard PC 010207, the Performance Improvement chapter at Standards PI 010101 and PI 020101, and the Medical Staff chapter, applicable to critical access hospitals only, at Standard MS 050101. The enhanced elements of performance will require organizations to do the following: provide staff and licensed independent practitioners with educational resources and programs to improve pain assessment, pain management, and the safe use of opioid medications based on the identified needs of their patient populations. Involve patients in developing their treatment plans and setting realistic expectations and measurable goals. Facilitate clinician access to prescription drug monitoring program databases. Conduct performance improvement activities focusing on pain management and safe prescribing to increase safety and quality for patients. Ensure that the critical access hospital medical staff take an active part in pain assessment, pain management, and safe opioid prescribing through participating in the establishment of protocols, quality metrics, and reviewing performance improvement activities. And monitor high-risk patients in critical access hospitals. Because a substantial burden of pain exists throughout the United States, combined with gaps in the evidence on optimal pain management and a continuing opioid crisis, it's necessary to provide applicable accreditation programs with contemporary guidance for pain assessment and management, including safe opioid prescribing. The standards changes will be displayed on the pre-publication standards page of the Joint Commission website. The revisions will also be included in the Fall 2018 edition update and the 2019 hard copy publications of the Comprehensive Accreditation Manuals for the Ambulatory Care and Critical Access Hospital programs. For more information, please contact Natalia Rosenberg, Project Director, Clinical Department of Standards and Survey Methods at the Joint Commission. Now stay tuned for today's JCR QSN program.